I run the London Social Prescribing Network, and I'm delighted to welcome Samina Nigu and Mihai Bikai from the Roman support group. And they'll be running today's session for us. If you want to learn more about the Social Prescribing Network and what we do and join us, then we'll put a link in the chat for you.
Thanks very much, Stephanie, for the introduction. Hello, everyone. My name is Mihai Bika, and I work at Roma support group. We are a charity based in East London supporting Roma communities. I coordinate the policy and campaigns work at Roma support group. And I have here today with me my colleague Simina. Simina, if you'd like to say a few words about yourself as well.
Sure, thank you, Mihai. Hi, everyone. My name is Simina Nagu. I'm the Roma support group mental health coordinator. And together with Mihai, we also work on a project called the Health and Wellbeing Alliance, which you'll hear more about. Over to you, Mihai.
That's great. Thanks very much. I'm just kind of... are the slides moving? Can you see that?
Yeah, we can see it.
Yeah, all good.
Oh, that's great. That's great. Good. So a few words about Roma support group. We are a charity set up in 1998 in East London to support Roma migrants settling in London and in the UK. We are mainly a support and advice charity, and we've been doing that since we've been set up. Over the years, we've also developed the range of activities that we do, starting to do a lot of work around promoting the culture, traditions of Roma communities, but also doing work to increase aspiration of young Roma people, and also to do policy and campaigns related work, which I coordinate at Roma support group. And in the past 10 years or so, we're doing quite a lot of work around supporting professionals in their own work with Roma. So we have a specially designed project and program around this, which, as I said, is designed to be able to answer to challenges that different services or charity organizations, professionals have in their own work with Roma. So please feel free to get in touch with us if you need support from us on that. We are members of the Health and Wellbeing Alliance, which Simina mentioned, and this is a cross-government program financially supported by the Department for Health and Social Care and the UK Health Security Agency. And it's a program which brings together various policy leads across the system, working with organizations representing different vulnerable sort of communities in order to create that bridge between our communities and the system, to work together to develop strategies, policies, and so on, or to influence them in order for improving the outcomes, the health-related outcomes of our communities. And through this project, we've been doing this work with our partners from Friends, Families and Travelers, which are a charity based in Brighton, working on behalf of all the communities under the Gypsy, Roma and Traveller umbrella. I'll very much invite everyone to check our websites if you want to find more information about us. And I think you can easily Google us and you'll find information you'll find our websites easily. Now, over the recent years, we have conducted work to try and support services, either different services within the NHS or in the Department for Health and Social Care or the UK Health Security Agency, to support these services in increasing their understanding, their knowledge, and improving their kind of way to work with people from our own communities. So over the past 3-4 years since we started doing that work, we realized there is a gap in terms of information within the system in regards to experiences that people from our communities have in their engagement with health services and so on. We've also seen that there is a lack of information in the policy or strategy development process regarding Gypsy, Roma, or traveler communities. And that was particularly in, for example, the primary care area, in maternity area, social prescribing area, mental health, and so on. So we've decided to do some sort of strategic work around that. And that transcribed into carrying out research into these areas, but and developing reports, but also developing guidance and materials which can assist health-related professionals in their own work with people from our own communities. And for that purpose, we have looked at, for example, what exists out there in terms of data, in terms of literature regarding our communities. We spoke a lot with people from our own communities, either through surveys and focus group meetings or interviews. And we've also spoke a lot with members from our own teams, which have a lot of experience regarding our own communities. When, for example, doing the surveys, we have been a little bit sort of flexible around the way we do that, and we've engaged a network of Gypsy, Roma, or traveler community advocates in that work to be able to offer one-to-one assistance to people from our communities, so they are actually able to do these online surveys, and that enable us to reach nearly 150 people from our communities to conduct this series of surveys. And our network, our reach into the community, enable us to recruit people to do the focus group meetings or interviews that we had. As I said, both of our organizations have a long-standing experience of working with people from our communities. You know, Roma Support Group is there for 26 years now, and so on. So we've also looked into the consideration experience that our colleagues have in informing the research that we've done for the guidance development. So as I said, we've done research in the primary care area, and the social prescribing area, the digital exclusion area, and how that impacts on access to health, but also maternity and mental health sort of area. And today we'll try to present the main findings we've identified through this work, and we'll look particularly at primary care. We will also look at what we've identified in the social prescribing area, and we'll also touch on how digital exclusion impacts on people from our communities and their interaction with health services. We will also have some time for questions as well. I very much invite everyone here today to drop your questions in the chat box as I'm presenting. I might not be able to answer the questions straight away, but we will pick up on those questions in the Q&A session when that comes. Now, we'd like to start with understanding a little bit about who are we talking about today. So you very likely are already familiar with the so-called GRT umbrella, which stands for Gypsy, Roma, and Traveler communities. But this is a very kind of, the communities under the GRT umbrella are very diverse communities, and this means diverse culture, traditions, diverse experiences of engaging with health services and with other services as well. And we've included here the main communities included under the Gypsy, Roma, Traveler umbrella. So we can't talk about one homogeneous community. You see here that we have Roma people, Romani Gypsies, traveling, show people, Irish travelers, new travelers, and so on. So there is a very sort of rich diversity under the Gypsy, Roma, and Traveler umbrella. But we will move on with a little bit of interactive exercise today to help us understand more about these communities. And I'm launching here a question to all of you present today. to think about, who are the Roma, Gypsy, and traveler communities. And I'll invite everyone to answer in the chat box to say if they think that the question we have included here is true or false. So what do you think? Do Roma, Gypsy, and traveler people share the same ethnic origin? So please use the chat box to answer with your opinions on this. So I'm looking at that, and I can already see that actually everyone is saying that the statement is false. So it clearly your opinion is that the statement is false. So let's see if that's right or not. Yeah. So the statement is actually false, as you very rightly mentioned in the chat box. And indeed, our communities do not share the same ethnic origin. In fact, when we look particularly at the Roma community, for example, we know from whatever historical evidence exists out there, although there is not much, but there is some. There's this evidence indicate that Roma people used to be part of a group of tribes of people that were living in the northern part of India until about 1,000 years ago. Now, we don't know exactly why Roma people started to migrate from India. Some people believe that it was a local war or some local argument between the community and the leadership of that region around that period, which kind of pushed people to start migrating to other parts of the world. But what happened when Roma people were still living in India, we were very much kind of split into different groups or tribes of Roma, mostly according to what we used to do for work. So the tribe was split mostly according to what sort of jobs people had, and there was also a caste system in place, which was similar to the one that the Indian communities have. And I, for example, particularly, I'm coming from a Roma tribe that makes bricks. We were called the brick makers. Now we don't do that as much today. Our tribe is not as active as it used to be until about 50 years ago. That's because of the industrial development and factories starting doing that a lot cheaper and so on, but also because of different attitudes towards Roma people in Eastern Europe some decades ago. But what happened and the impact that had when we started to migrate, we split a lot and took different paths towards finding a new place to settle. And this means that today there are Roma people living all across the world, pretty much on all the continents, with this belief that there are 12 million of Roma living across the world, and 6 million of Roma in the European Union only. Yeah. So we're talking today about a very, very diverse Roma group, which kind of settle in different countries, in different parts of the world, and so on, at different times in the history. And when we look at the other communities under the Gypsy, Roman Traveler umbrella, we, as I mentioned, we see that we have included here Romani Gypsies, Scottish Gypsies, Welsh Gypsies, or Romani people. Now, what I can say is that all the kind of Gypsy sort of groups which are known to live in the UK do share the same ethnic origins with the Roma. Yeah. So when we look at the Gypsy, particularly the Gypsy, Romani Gypsy, who live in the UK, now if you recall what I said regarding Roma starting to travel and migrate towards part of the world, we know today that a group of Roma, of those Roma people, after they started migrating from India, a group of us managed to kind of reach the UK territories about 500 years ago. And when that group of Roma arrived in England and the rest of the UK, locals believed that we are Egyptians, and they use the word gypsy as a short for Egyptians, and therefore we become sort of known in the UK as gypsies. And indeed, as I said, gypsies, yeah, the Britons, the Britain, UK gypsy people, and the European or the worldwide Roma people do share the same ethnic origin. Yeah, but when we look at Irish travelers, new travelers, boaters, and so on, they do not share the same ethnic origin as Roma and the Romani gypsy people. But they do share to some extent the lifestyle, being a nomadic community, and unfortunately, in some cases, they do share sort of the negative kind of aspects of life, like engagement with services, health outcomes, educational outcomes, and so on. Yeah. Now, I think it's important for people to know that when we talk about Gypsy Roma traveler, we have to bear in mind that diversity and the community. And think about the implications that using acronyms like BAME has when also thinking at the Gypsy Roma traveler community. So I'm very much kind of inviting people here, in your own work, if you do come across someone from our communities, try to pick up who you actually have to do with, so you can put in place the right measures and the right things, taking into account the different cultural aspects, language and so on. Yeah. Now, it is believed that there are today at least 300,000 Gypsy or traveler community, and a similar number when we look at the Roma communities. Now, this is a sort of an estimate by different kind of charity organizations, activist professions, and so on. We also know today that according to the 2021 census, we have altogether we have just over 170,000 Gypsy, Roma, and traveler people living in England and Wales, who, these are all people who ticked either the Roma or the Gypsy or traveler box when they filled in the census survey in 2021. So of course, yeah, we're not very sure exactly of the size of the community, and that has to do with different reasons, mostly with people's kind of willingness to disclose their ethnicity publicly, and that's especially for fear of persecution, so for fear of how that information will be used, for fear that it will be used against them, and so there is still a kind of a high levels of reluctancy within our own communities to disclose either Gypsy, Roma, traveler identity. It's also relevant for people to understand that not all the communities under the GRT umbrella are nomadic communities. In fact, vast majority of Roma people are settled today all across the world, including in the UK. We know, according again to research and to the data available, the public data available, we're seeing that we think about 30,000 Gypsy or traveler people who maintain a nomadic lifestyle in the UK. So the majority of our communities are actually settled. Yeah. Now, the Roma people who we are kind of referring to today are mostly Roma who migrated to the UK in the past 30 years or so, especially from Central and Eastern European countries. So pretty much all the experiences that we have at Roma Support Group in regards to Roma, and when we refer to Roma, we will refer to Roma people who migrated to the UK, as I said, in the past 2 or 3 decades from Central and Eastern European countries, mostly from countries like Romania, Poland, Slovakia, and so on. So I hope this kind of was helpful for you to get a very brief glimpse into the Gypsy, Roma, and traveler communities. Now, why we talk about our communities in the health sort of context is because we have seen and we are seeing that there are communities are facing very poor outcomes in relation to health, and that became very obvious during the pandemic. When we've seen the government and the respective kind of departments within the government developing the so-called Core 20+5 initiatives, which identified a series of communities who need accelerated improvement, and that's because the system identified that these communities are experiencing kind of more negative, higher levels of negative outcomes in relation to health, more challenges around engaging with health services, and sort of less representation from their own communities within the services, as either as human resources or as kind of leadership or involvement in strategy or policy development. And the program, the Core 20+5, it particularly includes people from our communities in the plus sort of category, which specifically mention Gypsy, Roma, and traveler people. You also see here the other categories which are included in the plus section of the Core 20+5 program. And we do have now the so-called inclusion health groups kind of category, which our Gypsy, Roma, traveler communities are a part of. Now, there are a series of major kind of factors influencing the health outcomes of those from our communities. And we particularly look here at factors such as education, employment, and accommodation. We look at, for example, on the educational sort of thing. When we look, we have to see it again separately within the Gypsy, Roma, and traveler umbrella. When we look at Roma, for example, specifically, we're seeing that there are quite low levels of education amongst parents and adult Roma population, as the experiences that Roma had in the country of origin is very different to the experiences that the young generation has in the UK. So when we look at the adult Roma population, we're seeing, for example, that in countries like Romania, Roma people there, it's percentages of up to 60% of the community is considered to be functionally sort of illiterate. So people who are able to kind of read a text, but they don't understand what the text is about. And this is a huge kind of problem that we are seeing at Roma Support Group, with people coming to us saying that, I can read this letter, but I don't understand what it is. And very often people come to us with health-related letters for us just to read and explain the content to them. And that happens in the Gypsy and traveler communities as well, with a younger population who either came from young or were born in the UK. Although the educational kind of engagement is different and it's better comparing to the rest of the Europe, we're still seeing quite poor educational outcomes in the Gypsy, Roma, traveler communities, and that has quite a lot to do with bullying experiences that young Gypsy, Roma, traveler have in schools, with the high levels of school exclusions that is happening, much more higher than comparing to other communities. When we look at particular school exclusion, we're seeing that Gypsy, Roma, traveler pupils are up to 5 times more likely to be excluded. So this, unfortunately, although the situation is better, as I said, it has a direct influence on the level of education and so on. And obviously that has a direct influence on understanding, the sort of health system, engaging with the health system, educating yourself in order to prevent rather than treat, and so on. So that has a direct impact on health as well. When we look at employment as well, we've included here some data from the 2021 census. And I'm inviting everyone to have a look at that, as there is a specific page for Roma on the ONS website, looking at the census data and the outcomes of that. And also there is a specific page on Gypsy and traveler communities. But we are seeing that overall kind of Roma people and also Gypsy and traveler people work in the lower paid sort of sector, or mostly are self-employed. And that means that people are more likely to work for more hours, or not have a security of jobs and so on, and have a lower income as well. And again, that has a direct impact on health. And in terms of accommodation, the picture here is a bit sort of more diverse, as you know, within the GRT sort of umbrella, we have, you know, people who are still living nomadically, others who are settled and so on. And the impact that has on health is different. So for those who are settled, especially Roma, we're seeing higher levels of Roma people living in overcrowded accommodation and in poor kind of housing sort of conditions, renting usually from rogue landlords and so on. And their accommodation and the standards of their accommodation has direct impact on their health. When we look at the Gypsy and traveler communities, especially those who are still living nomadically, many of these people do not have access to appropriate sort of sites, and because there are not many authorized sites where people can stop and have access to all the facilities needed, many of the Gypsy Roman or Gypsy or traveler people have to stop in unauthorized places, and that means that they don't have access to things like water, electricity. Probably it's far away from a GP or a hospital and so on, and then again directly impacts the health sort of outcomes of our communities. Now we'll kind of touch a bit on the main findings that we had from the different sort of pieces of research that we've done to help you get an insight on these issues. Now, when we looked at primary care services and how much people from our communities engage with that, it didn't came as a surprise for us to see that there are higher levels within our communities of people who are not using primary care services at all, and also people who are not registered with the GP, for example. As you can see, 2 out of every 10 Gypsy and Roma traveler people that we've engaged with through this process told us that they're not using primary care services at all. 2 out of every 10 are not registered with a GP. 8 out of every 10 are not registered with a dentist, and the same goes for people accessing opticians for eye care. Now there are a series of reasons behind that, where, for example, in the case of Roma, it's either lack of understanding of knowledge of how the system works and so on. And overall, for all the communities, there are different sort of practical issues with why people are not using primary care services. And we've seen situations where people from all the sort of communities under the GRT umbrella not being able to access primary care services because, for example, they don't have an address. They can't prove they have an address when they try to engage with these services, either because they live on an unauthorized site, being a Gypsy or a traveler people, either because of renting out from a rogue landlord or not having a contract from the property that people are renting in the case of Roma, but also some Gypsy and traveler communities. For the Roma, there are also the language barriers and so on, which are preventing engagement with primary care as well. And also a lack of understanding of how the system works, of how people can be registered and so on. Lack of appropriate support for people to be able to engage with primary care services. And we see this especially with sort of new arrivals of, within the Roma community. So until they build a social network around them to try to find the right people to support and so on, people don't really know how they can register with the GP, what they have to do to access a dentist and so on. And also because of the lower kind of levels of education and the limited levels of engagement with services in general, people are lacking access to information regarding, dental care, regarding, caring for their eyes and so on. We'll talk, we'll touch a bit later on the kind of overall sort of barriers to engaging with health services as well. Now, when we look at social prescribing area, again, it didn't come as sort of as a surprise to see that there is very little knowledge and very little experience within our own communities in engaging with social prescribing services. So part of this exercise, as I said, we spoke with nearly 150 people from our own communities, and we've seen that only 1 out of 10 people confirming with us that they have used social prescribing services. Pretty much everyone that we spoke with don't know exactly what social prescribing is. But when we've explained to people what the service is about, and then we ask them what they think, what sort of support they would need if they would come across, a social prescribing service, we've seen that majority of people told us that they would either need support from a social prescriber in order to access health services or to access support with housing. Yeah. Now, we will be able to share the kind of reports that we've produced out of this research, where everyone will have an opportunity to see the findings in greater detail. As we speak there about, what will help, what sort of understanding people have in relation to social prescribing, what people think of social prescribing when they hear just the word social prescribing, what will help, what sort of activities will help to increase people's knowledge of social prescribing as well. And we've also, part of this exercise, we also spoke with a lot of professionals in the area. So we're also sharing in the report the experience that professionals had in the social prescribing area on engaging with Gypsy, Roma, and traveler people. Now, we've particularly wanted to look at digital exclusion, as in the past years, this became very obvious that it's a huge sort of issue for our communities. And we wanted to do this particularly in the sort of health area, because we are seeing the obvious kind of trend within the government in the health area, but not only, to move to a more kind of digital sort of space. So we wanted to look at the extent of digital exclusion, and we also wanted to look at what actually helps to increase ability of people from our communities to access health services in a digital way. And we've looked at, extent of digital exclusion in the community, especially in terms of access to devices and internet, and we've included here some data. So while quite a lot of people from our communities do have a smartphone, which is quite close to the national picture, we're seeing that the situation looks very kind of different in regards to owning an IT device, such as a laptop or tablet, or having access to internet. And obviously, that has a direct impact on our own ability to engage with health services, either to book GP appointments or, have, I don't know, a video appointment and so on. Now, again, I'm inviting people, and we will share links to all the research and all the data. But the work we've done, particularly on the digital exclusion aspect, Also looks at, for example, use of email, use of social media, and use of internet to access information. And we've also looked at what actually helps, what can enable a person from the Gypsy Roma traveler community to be able to use the digital sort of world, especially in the health area. Yeah. We've also looked at usage of the things like NHS app and so on. So hopefully that will help people to find ways of making it easier for those small communities to use the digital environment in the health context. Of course, overall, our findings identify the fact that people will actually prefer, to have that one-to-one, that direct sort of interaction with health specialists in regards to their, to their health needs. And one of the main recommendations we had in that report is for people to be offered, always to be offered the option to have an in-person interaction with a health specialist, be that a hospital or a GP, and so on. But we've also seen that, for example, people found very helpful, the NHS app when we were explained what the NHS app, when we explained what that is about. Yeah. So people are not kind of completely against that and so on. There are people who find things like that helpful. And we've seen instances where, for example, a Roma parent said that, their relatives or children are helping them to use the NHS app, and they found it helpful to be able to book appointments for that and so on. Yeah. But as I said, the main sort of recommendation in that area is to also offer in person. And not only the sort of digital opportunities to engage with services. Now, when we look at the barriers, as we come to this part of today's event, as I said, it's always helpful to see this from different angles, given the different communities under the Gypsy Roma Traveler umbrella. So we're not talking here about a series of barriers which would apply to everyone under the the so-called GRT umbrella. So very much inviting people here to dig more, so if in your area you're working more with Irish traveler or with showman people or with boaters or with Roma, try to dig more into that specific. Yeah. But overall, we're seeing, barriers coming up from the fact that people, for example, can't really engage with the services because they don't have a fixed address, so they can't register with a GP. People don't know that actually that's not a good enough reason for people to be refused registering to a GP. There are high levels of low or no literacy in our communities, especially in the adult Gypsy Roma traveler population. The language barriers, again, especially applying to those from the Roma communities. The high levels of digital exclusion as well, which I've just talked about, and particularly looking at Roma, the immigration status, as well as Roma are EU citizens living in the UK, and therefore their overall sort of access to health services is linked to their immigration status, and that kind of sometimes creates problems for Roma people accessing health services. But there are cultural barriers as well, especially the lack of knowledge within the health professionals regarding our communities and the different sort of cultural aspects of our communities, and how that reflects and then how that impacts interaction is you're seeing different remarks being made by health specialists regarding people from our communities, which are perceived as negative, you know, for those from our communities. We're seeing health specialists, you know, engaging with Roma, assuming that they live on a site. Yeah. So therefore, you know, assuming that they, you know, they are seeing a traveler person and so on, when that's completely not the case. And you know, we, for example, you know, it happens that you're seeing, I don't know, a male specialist having, you know, an appointment with a woman who has something to do with her lower part of the body and so on, which would be quite problematic in terms of how the interaction would go during that appointment and so on. So that sometimes has an impact on engagement with health services. And there are also, you know, taboos topic around health, which impact on the interaction between health services and people from our communities. Also, the sort of the administrative barriers, which I think, you know, that they're relevant for so many other communities, not just the Roma, Gypsy, Roma traveler communities. You know, the long waiting list, you know, lack of or limited local services available, especially for those nomadic people who live on unauthorized sort of site, which are mostly, you know, outside of cities and so on, in, I don't know, industrial areas and stuff like that, which are making it very difficult for those people to access services. Yeah. And we're also talking about, you know, that historical perspective and awareness of intergenerational effects. You know, so we're talking about, you know, adult, elderly, Gypsy, Roma travelers, sort of populations who had, you know, specific or certain kind of experience when engaging with health services, especially when we look at the Roma and the interaction, you know, the elderly, the adult and elderly Roma population had with health services in Central and Eastern Europe. And in some cases, the experience that they still have in these days with health services in that part of Europe, you know, that has also an implication here as well. Great. So I think we've kind of reached the sort of presentation of what we wanted to share with you today. And now we came to the Q&A session.
I'm going to kick the question session off because I was interested to hear you sort of say that there are health topics that are kind of seen as taboo. Are you able to sort of explain what those might be, and if there's different ones for different communities would be helpful to know as well, I think.
Yeah. Well, one area which is kind of considered taboo is the mental health area. But that's the first obvious one that comes to mind, and I think that applies to the different communities under the Gypsy, Roma and Traveller umbrella. And we're seeing that in our own communities, people don't talk about that very much. There is a very little, you know, knowledge of the different kind of the different sort of illnesses or the different diagnostics that people can get within the sort of mental health sort of spectrum. And the way that people refer to that, it's different as well. So, for example, for Roma people, we don't have a specific word, for mental health and so on. And we would rather say that, I have a pain on my shoulder, or I have a pain in my heart, or to refer, to the fact that you're experiencing some mental health sort of concerns. In the most recent years, we've seen, people also mentioning depression as well. So this is kind of the usage of this word is increasing over the past years. And so with the Gypsy and Traveller communities, we're seeing them speaking more about bad nerves when they refer to mental health and so on. And this is a sort of taboo topic because our communities being kind of excluded from mainstream societies, living at the margins of society, living on those, traveler sites in very kind of close communities and so on. People had to marry within the community, and kind of hiding, different mental health sort of situation within the family, was kind of a thing that people had to do in order to, if they had, several children, in order for, their children, to have a better chance to get married and form a family and so on. And also, there is a shame attached to it and so on. We've seen people, more and more speaking about it and realizing that this is something very, very real, and it impacts on people. We've seen very little knowledge around, as I said, different kind of mental health sort of illnesses and so on, to the extent that, there is little knowledge on, what autism is, for example, what schizophrenia or Alzheimer is, and so on, and how that impacts the people. We've seen Roma parents being told that their child has autism, and they initially thought that that's something which can be treated with a pill in 2 weeks' time, and so on. So, there is a huge need for education in that area. Also, kind of other taboo sort of things are all like things like pregnancy as well. The sort of health of the lower part of the body as well is something not, talked too much, within the community. People are talking, but in a certain way, for example, so young sort of Gypsy Roma traveler women, will not speak about the fact that they're pregnant very openly straight away with, and they will share that, I don't know, with a close sort of relative of the same age, the same gender, and so on. Yeah, so I invite people, again, to look at the reports and the research we've done, either in maternity area, the mental health area, and so on, where we talk more about taboo in more in to a greater detail. Is there any other question?
I think, Mihai, we had a question from Juliet Shapiro. I don't know if Juliet wants to ask it, but they wrote, do you have any suggestions for how healthcare professionals can increase their cultural awareness and any particular issues they should be aware of?
Yes, it's a good question. So there are offers for training out there. First of all, there are, there is an increasing number of Gypsy Roma travel organizations which have kind of developed in the past years, which, some of them do have a training offer, and invite people to check, that we are offering training. Our friends, our colleagues from Friends, Families and Travelers are offering training as well. And maybe what we can do is we can share a list of different Gypsy Roma traveler organizations and services from across the UK, which people can link with if they want to see what sort of trainings other organizations are using. Then also there are materials which our organizations have or other groups have developed, for example, on YouTube, different videos, short videos, like 3, 4, 5 minutes videos talking about our communities and so on. And I would also invite services to, find out if there are any Gypsy Roma traveler people, organizations in their own area, engage with those people, have a chat with them, and so on. If there is, if capacity or resources to, funding to do training doesn't exist, you can always have a chat with us and so on, which might help answer any of, some questions. But I think it would be good, first of all, to look at, consider the training option. also it's helpful, and this is something which we are kind of advocating for across the services, to try and see if there is a possibility to recruit and employ, advocates from our communities in your services. And we have seen this a trend increasing in the past years, especially in the health area, where we've seen hospitals in places like Liverpool, Sheffield, Ipswich, and so on, employing community advocates who have different roles under the kind of remit, mainly to help services engage with Roma patients accessing, either through interpreting and so on, but also to support, professionals in that hospital. If they have any questions about the community, they go to this advocate and so on, to try to increase their understanding so they can properly engage with their Gypsy Roma traveler patients. Other questions?
Yeah, we have another question from Katie. Do you have any recommendations how we can engage with parents and families regarding childhood vaccinations? So I guess again around engagement.
Yeah, that's vaccination and immunization. It's again a sort of a taboo topic, and I, in this case, I speak more about the Roma communities. I would say, especially those who are still, maybe you have adults or elderly Roma, who are still present in the family life, who had a specific experience in Central and Eastern Europe. And that's because, in those sort of different countries, decades ago, the engagement with Roma people was not very positive, especially in the health sort of area. We've seen, situations in countries like Czech Republic or Slovakia of Roma women being forcibly sterilized and so on. And so on. So that the experience is influencing quite a lot, attitudes towards immunization and vaccination in general. But I think that there is very little knowledge and understanding and education around how helpful vaccination, immunization for children is. It actually is. What impact that may have on children and so on. So I think there is a need for that, I think, kind of ground level engagement to build up education on this, because it's pretty much non-existent in our communities. There is very little like real clear information around immunization. There is a lot of misinformation circulating around it. And then when you have, when people from our communities only see the misinformation circulated and they don't actually engage with the real, clear, official sort of information, there is no chance for people to actually, change their opinion around that. So, I think there is a need for that sort of interaction, and increasing education around this is needed. And I think that, can be done in different ways, either engaging to the local Roma groups or Gypsy or traveler groups available, trying to work with schools and so on. I think schools are a very good avenue for that. Trying to work with through the Gypsy Roma traveler churches. I would say as well, that might be a helpful way forward. Now, the experiences, as I said, are quite sort of different, so I can't speak in detail to each of the communities, including in the Roma kind of cohort, because you're speaking about, Roma from Romania, from Slovakia, from Czech Republic, from, Hungary, Bulgaria, and so on. So the experiences might be slightly sort of different, and attitudes towards child immunization might be different. I think the reason, the level of awareness and understanding on this, it is increasing. Yeah, you know, like if I speak from my personal perspective, you know, I'm, you know, Roma and so on. My mother she's illiterate, never went to school and so on. But she, you know, did had people around her, neighbors, who did explain to her, you know, what it is about immunization and so on. And there was never a question for us not to do the immunization, like never. She was, you know, once she had someone around who could explain things to her, she was totally, well, you know, for it and so on. And that it was the same with my extended family as well. Any other last question?
I think we have another question around taboos. What are taboo questions?
Yeah,
It's
I mean,
an interesting one.
yeah, it's difficult to say what is, you know, taboo question. I think, you know, we've done an exercise some time ago to try to understand, you know, what is a difficult question. Yeah. And what we understood when we've done that exercise is that any question can be difficult if people don't understand why you are asking that question. Yeah. So I think it's very important when, you know, asking for something, you know, or a question and so on, to try to explain to people why you want to ask that question, and what you're using, in what way you're using the information. And then you know, like on taboo topics, in our experience, we were able to approach any sort of taboo topic. You know, we've done work on mental health, on, you know, pregnancy, on all sorts of topics and so on. As long as we've done it in the right way, it wasn't difficult. Yes. So if you want to speak with women about, you know, I don't know, about pregnancy or about health of the lower part of the body and so on. And if you have a woman of the same gender and so on, and the right environment to ask this question, you know, then you can ask it. Of course, if you have a man, you know, asking a woman a specific thing, that might obviously be problematic. You know, also, for example, we've seen, you know, and again, going to the maternity area, you know, something challenging when health maternity sort of specialists expect for husbands to be present during the delivery and so on. And that's, you know, experiences that we, you know, Gypsy, Roma, traveler fathers don't really want to be involved in that, because, you know, of kind of giving space to the mother and, you know, respect and so on. You don't, yeah. So that's a kind of difficulty to yeah, discuss. So I would like to say thank you now. I think we've just gone a little bit over the time. I'm inviting everyone to please, you know, ask any questions, send any emails to Stephanie if that's helpful. We also adding here our the ways you can reach out to us directly if you want to ask any questions. Be very helpful to answer anything. Thanks very much for joining us